Supraspinatus tear. It is a tear or rupture of the tendon of the supraspinatus muscle. When one or more of the muscles are torn, the tendon is no longer fully attached to the head of the humerus. The shoulder is made up of 3 bones: the humerus, clavicle, and scapula. There are 4 rotator cuff muscles that include the supraspinatus, infraspinatus, teres minor, and subscapularis. These cover the head of the humerus. As you can see, the supraspinatus is located at the superior end of the scapula on the posterior side of the shoulder. This tear usually affects the dominant arm in a person and occurs from trauma. An acute tear, which occurs with the other shoulder injuries from heavy lifting and falling on arm, or degenerative, where wear and tear from the tendon slowly over time. Degenerative tears increase with age, and usually when it affects one shoulder, you are at greater risk for a tear in the
So some risk factors are being 40 years or older, males are more likely to get a tear rather than females, smoking, genetics, body mass index, height, repetitive exercise, past trauma, lack of blood supply, and overhead activities. So some signs and symptoms are pain, aggravation in overhead or forward flex position, limited rotation of motion, weakness, clickness, stiffness, instability. Some characteristics or clinical presentation that might be seen as partial thickness or full thickness in the tendon. To be diagnosed with a rotator cuff tear, a doctor might have you go get an X-ray, MRI, a CT scan, or an ultrasound. So these pictures are MRIs. They show you a normal rotator cuff versus a torn rotator cuff. So during your physical examination, the doctor may ask a series of questions like your pain levels, aggravation factors, activity limitations, past medical history, or possible overhead activities you're involved in. The doctor may also do a series of tests like a range of motion test or a drop arm. So some non-surgical treatments are rest, avoid activities, anti-inflammatory medication, physical therapy, and steroid injections. Arthroscopy is a surgical repair, which is reattaching the tendon to the head of the humerus. So this picture just shows what an arthroscopic repair surgery is and what is used and what it looks like. So in my right shoulder, I was diagnosed with a small rotator cuff tear with bursitis and tendinitis. It is small, but it is also painful, especially with overhead activities. I've had multiple cortisone injections, gone to physical therapy, and have had a lot of anti-inflammatory medication.